Hi everyone, I'm Marcus, the fourth speaker of the opposition's debate. What is attenuating growth? According to my first speaker, it speaks of a way to permanently stop the physical growth of a person. Why do we approve of attenuating the growth of the child is that we want the parents to take care of the child with profound developmental disabilities with ease. It is difficult once the child is reaching adulthood. The proposition speaker speaks of the unnecessary procedure done to Ashley. In all medical procedures, there are none that are unnecessary. Take vasectomy for example. Many men undergo vasectomy to stop producing sperms so that they would not make their wives pregnant again. It seems like an unnecessary procedure, but why do they undergo the surgery? It is in the same context as attenuating the growth of a child with profound disabilities, thus making it a necessary medical procedure. Moving on, many doctors do not do these procedures for the fame. They do it for the welfare of the child and of the parents. My third speaker has already mentioned that doctors take up an oath before becoming professional doctors. Doctors will only look to such procedures if the parents have asked for it. In this case, the parents have gone to a doctor seeking medical treatment for their daughter who is suffering from profound disabilities. The proposition also voiced out that the parents should be critical in Ashley's case. I believe that every parent wants the best for their child. Which parent would want to cause harm to their special ones? The parents of Ashley definitely had a good reason to go to the doctors for help. Ashley, who had a physical age of about 15, will be undergoing puberty. How can a mind of a 3-month-old understand what puberty is? I am also very sure that before you want to undergo a surgery, the doctors will brief you on what side effects that a surgery will cause. The proposition has talked about how putting Ashley under a high dosage of estrogen will introduce many side effects into an already complex situation. Let me take this opportunity to compare this particular surgery to other procedures like chemotherapy for cancer and other major diseases. Chemotherapy's adverse side effects include the depression of the immune system, fatigue, bleeding, nausea, and hair loss. Some patients even develop tumor lysis syndrome because of the rapid breakdown of malignant cells. If there are so many side effects that they can harm a body even more, then what difference is there to the high dosage of estrogen that has many side effects as well? The proposition also tells us that by making Ashley undergo such procedures, there are no medical reasons to it. If there weren't any, then why would the doctors even introduce such a procedure to the parents? Or is the proposition trying to say that the doctors do not know what they're doing? To every surgery or procedure, there will be a medical reason behind it. On the opposition's view, we are not trying to say that attenuating growth is a must, but why can't we give it a try? Every human body is different, and we cannot know for sure whether a person's body can take it. That is why doctors take a measured view on the seriousness of the case at hand and not just make any radical decisions. If you never try a method, you will never know if there would be any success rate. I, for one, do not want to see Ashley undergo any surgery. But for the sake of her welfare and her future to live in a constantly moving society, it is best for her to be treated in the proper manner rather than not doing anything about it. In general, attenuating growth should be allowed.